Well, a typical day on the ward I'm on a low secure unit, and on the ward obviously I'm not on medication myself, but medications are given out about 8 o'clock, 8:30 in the morning. But the ward I'm on, it's mostly about giving you as much independence as you can possibly cope with yourself. And at the same time, it's not like a medium or a maximum secure ward where more things are done for you. It's a ward where there's the opportunities to be able to be independent, like I said, as much as possible. But at the same time, the staff are there if you need them. Daily routines are like that from a Monday to a Friday, where obviously all sorts of different areas and interesting subjects, from ceramics to learning a language, doing your basic maths and English if you want to learn and strengthen those areas. And you have art. Art's a pretty big thing on my ward, actually. The ward I'm on is quite a few people interested in art, and some patients are winning competitions, and one patient's just come back from London, been in the Kessler Awards and doing very well for himself. And just from a simple little thing, if you can find, I think, a patient or anybody, I keep saying the word patient, but a human being, the person, can find an interest and help to develop that. And I think that's a very good thing, because it can open doors to other areas, giving you self-esteem, giving you strength and the ability to perhaps look at things in an easier way which you struggled with over the years. So the main part of the week, the most important thing, is obviously occupational therapy. They sit down for 2 hours, and sometimes you're invited for 10 minutes at the end. And I've had many in my previous ward where I've wanted to actually be involved with my care plan, and I've been invited to 10 minutes at the end. And I find that's really pretty bad when you can't be there part of with the question time, really, and what you feels right for you. But to go along and be told, this is what's going to happen to you, this is what we've discussed, and this is how it is, I find that pretty degrading in a way. It doesn't happen on all wards, and it certainly doesn't happen, on my ward I'm on at the moment. Big thing for me is that we have sometimes in the past we've had community meetings, and rules have been made by the hospitals and different placements where people have been, and suddenly we'll put a notice up. And in the end it's about this communication aspect, where you have notices all over your ward, do not do this, or this is that, or this is this. And at the end of the day, they're so ineffective, because they just become pieces of paper. And when I think within the mental health system, what's changed over the years, the pieces of paper have disappeared. And you've now got more in the line of people communicating face to face now, and actually listening. And patients can get involved with their day-to-day routines by having a ward-based rep who attends all these meetings, patients' council meetings, and you can attend management meetings as well. But also not forgetting, some hospitals, not all of them do it, you have a regularly monthly meeting where you meet with all the managers in a forum where all the wards can attend and say, this is happening, that's happening. And what I'm finding is really working, now that there's more help, care, and patients feel safe and able to speak more, they're actually raising more things. Sometimes things that perhaps management don't want to hear about, where years ago they would have been scared to raise them. But that's happening now, and things are actually improving from that. One of the bigger things which I've noticed what's happening now in a lot of hospitals, when you make a complaint now, internal complaint, when it comes back, the chief executive will have written at the bottom, we are finding ways to improve that this won't happen again. And thank you for raising it, because we'll work on this now. Not like, yes, your complaint's upheld, or no, it isn't. Full stop. Where now they're finding ways to improve your quality of life. So I've seen many changes over the years, and I like to think today they're for the better. But there's always room for improvement.